Thank you, wonderful. So we have lots of people signing in. Thank you very much. I'm going to give you a minute or two to do that. If you're wanting to be sure you're in the right place, if you are interested in the COVID-19 rapid response webinar for economics and all the disciplines that we need to work with in economics to make progress on this, you are in the right place. Welcome from all over the world. Wonderful to have so many people, and it's been, I want to say, remarkable, the response that we've already been seeing. As people continue to sign in, I think I'll go ahead and go to the next slide to show you that we have a Google Doc with a link that will provide you the chance to fill out information. You do not have to fill this out. This is utterly up to you. What we are trying to do is collect names and interests of people who might like to be involved in follow-up. There's a few questions in there to see if you have suggestions, to find out if you are working in this space. There's absolutely no need to fill this out, but if you are interested and would like to provide your name for us to consider in any kind of follow-on activities, we will do that. I'm going to leave that up for just a second, give people a bit more chance to sign in before we jump in another minute or two. All right, well, I think I'll go ahead and get started. We have a short amount of time and we certainly want to take advantage of this opportunity. Welcome to everyone who has joined us on this rapid response webinar. My name is Cathy Kling. I'm an environmental economist at Cornell University. Together with my colleagues Eli Fenichel and Jay Shogren, we're hosting this, what we are calling a rapid response webinar. None of you need me to tell you that we are living in a highly uncertain time, in a time when the stakes are very high, and many of us are worried and concerned. But we are a research community with data, models, and methods that can be leveraged immediately to provide some short-run, intermediate-run answers to things that decision makers need information about right now. Many of you are keen to step up. Many of you already have. It has been remarkable to hear how much work is already being done by our colleagues, economists, behavioral economists, joining forces with epidemiologists, public health officials, and so on. This is the kind of energy and effort we as a community need to bring, and we as a community can bring. That's the goal of this webinar, is to provide information exchange and a way for people to better coordinate and talk about what they are doing and share where they are. It is extremely important at this time not to be duplicating efforts. It is even more important not to be siloing disciplines. We cannot work alone as economists or as behavioral scientists. Epidemiologists cannot work alone. We need everyone to work together. This is critical to have information that we are all sharing and talking to the right group of people. We decided that the quickest way to hear from, to move this forward was to hear from researchers currently in the weeds in this work. We know there are many more, but we have 9 amazing people who are currently undertaking research in this area with ideas and have agreed to join with us to share what they're working on right now. As you listen to these talks, I urge you to think about what you can do. Think about what data, models, and information you have access to that you can use right away to inform decision makers. Think about reaching out to journal editors who are trying to do, and many are doing, very rapid turnaround for information provision so that stuff that needs to get refereed can get refereed quickly. But remember, there's a lot of things that you can do to inform local authorities, state, federal authorities, decision makers and businesses in your own community that don't need a referee process. They need data and they need insights from the kind of information you can provide. Next, I'm just going to give you a super quick overview of what's going to come in the next hour and a half, and then we're going to jump right in. We have 9 speakers who each have prepared a 5-minute presentation. This is the order in which we have them queued up. When we get started in just a minute, each one of them will get on, they will have their time, they will speak. If they go past 5 minutes, I will interject and politely ask them to move on. But don't worry, these slides will all be available afterwards if we don't get through every one of the presentations. We are videotaping this and it will be posted. You can find the information for that on the link that you used to join this. We hope to widely disseminate this afterwards. Finally, there is a chat window live and active, as many of you have no doubt seen. We cannot take current questions or communications from chat and share it with speakers, but we will collect all of that information and do our best afterwards to triage it and get it to the people that it seems most relevant for. At the very end, we have 20 minutes or so of a panel discussion where we have several high-level thinkers that have agreed to listen and then comment on what they heard and identify what they think are other areas that are in deep in need of quick response. With that, I'm going to stop and I'm going to turn it to our first 5-minute speaker, Flavio.
Am I being heard? Yes? Can you hear me now?
Yes, okay. I can hear you.
Thank you very much. Thank you very much, Cathy. I'd like to first thank Cathy, Eli, and Jay for putting this together. I think this is a high time that we get together and pool our knowledge and skill set to deal with this very important problem. If we could just go to the next slide, please. Okay, great. Thank you very much. So I have the task of doing 2 things in 5 minutes. First of all, I'm going to try to summarize half a century of research in 1 slide. And then in the next slide, I will try to see what are some of the issues I think are important going forward and how they relate to the literature that has gone before us. So you just go to the next slide. Thank you. So just to bring everyone up to speed, oh, hang on, one back, please. I think we skipped the first slide. Just go 1 back, please. There we go. Okay, thank you very much. So the discipline that we are all interested in is the economics of infectious diseases, and is basically a subfield of economics that uses the tools of economic analysis to inform studies of epidemics and infection control. It turns out that there have been 2 main sets of tools from economics that have proved very useful in this endeavor, namely dynamic optimization techniques and game theory. And I like to think of the main strands of research as being the following 3, and these also are roughly how they emerged in the literature. So the very early contributions that were in the 1970s, many of them in operations research, were concerned mainly with how a social planner or a benevolent health authority might use resources optimally in order to control an infectious disease. Now, they were not fully satisfactory from an economics perspective because they lacked, in some sense, decision-making by individuals in the populations, and so they were very much like the kind of models that would be useful, maybe even in the management of a non-human population. Now, in the 1980s, there was a resurgence of interest by economists that was born out of a need to understand the incentives around people's decisions in the face of the HIV/AIDS epidemic. And so there was a very interesting literature that started growing out there in the 80s that very much took individual decision-making incentives and information into account in trying to understand what were individual decisions and what were equilibrium outcomes in this kind of settings. Now, in the last 10, 15 years, and this is where I have had most of my research, there has been a hybrid of those two literatures that looks at not just individual decisions and the kind of outcomes you'd expect when you take economic incentives into account by people in the population, but also how individuals respond to the kind of policies that a social planner or a public health authority might try to implement. So I think going forward, this is the area that I think many of us will be discussing, basically how do individuals behave when they are being asked to behave in certain ways. For example, when quarantines are being imposed on them, well, are they likely to follow suit, or are they likely to do their own thing? So this interplay between decision-making from a centralized authority and individual behavior by individuals in the population, I think really is the key to many of the policies that have been proposed and that we will be having to make decisions about going forward. So if I could just go to the next slide then. Thank you. So I think already now there are contours of what I think of as a new emerging field. And just to coin a phrase, I think we could think of it as social distance management. So these are basically the set of tools and policies, not necessarily pharmaceutical only, but also pharmaceutical, behavioral, and otherwise, that can help us inform how we best deal with situations like the one we find ourselves in right now. And just to echo what Cathy was saying, I think this is going to be an effort that is fundamentally interdisciplinary in nature. And I'm going to just point out a few examples. So, for example, recently, the mayor of London reduced the number of open underground lines in order to reduce the transport on the London Underground. Now, as a consequence, unfortunately, what happened is that the people who did want to travel crammed into an extremely overcrowded underground. And so in some sense, this was a policy that backfired. Similarly, in Italy, there were leaks of government policy to close off the north of Italy. And as a consequence, there were thousands and thousands of people that flooded out of the north and down to the south. Again, this is in some sense, a fairly predictable outcome if you take individual decision-making into account, but clearly this was something that the social planners had not thought of. So going forward, there's lots of situations like that, and we will need not just the efforts of epidemiologists and economists, which are probably the large part of the audience today, but we also need to engage with people that know about network science, crowd management, transportation engineering. We need to understand what happens when we limit people's ability to move around in society. Also, there's a whole set of issues that touch upon other disciplines within economics, such as supply chain management. There is what I call a social input-output structures. So not the old-fashioned input-output about how do intermediate goods become final goods, but who works in which sectors and how do they depend on other sectors. For example, can we close schools? Well, if we close schools, maybe we'll have to close the hospitals because they're interlinked through their workforce and so on. So I think these are very, very important issues that we would have to take an integrated approach to dealing with. So just to plug my own work, if you're interested, you are welcome to visit my page. But also, if you're interested in the literature, I am fairly conscientious when I do review the literature. So I'm also invite you to see what has gone before so that we don't spend any time reinventing the wheel.
Thanks, Flavio. Next, Eli.
Well, thank you all for joining today. It's really great. You're all, it looks like 423 of you are here right now. Next page, please. So I've been working on economic epidemiology since I was a master's student, and specifically on the economics of social distancing for over 10 years. One of the things that while we all want to give advice and we all want to help, I think it's kind of we're at a point where we need to stop writing op-eds. People know there are trade-offs. And when my wife tells me my opinion doesn't matter, I think I take that to heart and roll up my sleeves and start looking at the data. What we do know is that there's a lot of relevant data out there that decision makers aren't actually pulling together, as sort of Flavio was just saying. We know that we can use those data to better understand the distancing processes that are in place and some of the trade-offs associated with those distancing processes, so we can mitigate some of the side effects or unintended consequences of distancing, because it's not going away in the near term in most places without a major spike in COVID-19 mortality. What we've been able to do here, Jude Bam and I had been working on for a while on a paper on economics of school closures and during an epidemic, and we realized right away when this all got going that the healthcare workforce has to take care of their kids. We had a paper come out last Friday in Lancet Public Health, where we basically show that we provide some evidence that it's a really hard call whether or not closing schools will actually increase or decrease mortality. And the reason for this is if you close schools, health workers might need to stay home with their kids. And we are able to quantify that using data from the US Current Population Survey. Now, this is a data source that's very rich about, at least for the US, about the US population. Other countries have similar data sources. We've been able to really get in and provide a lot of really actionable data for decision makers. So we had a preprint of this paper. A colleague of ours here at Yale in child psychology contacted me and said, you guys calculated how many healthcare workers are going to be affected, but do you know how many kids? So in about 4 days, we went back to the CPS. We're able to estimate the childcare demand under a number of different assumptions for healthcare workers. We're able to append to that how many workers there were licensed to care for kids. We're able to do this down in the metropolitan areas. And so we put up this dashboard really quick. And that dashboard was cited in a Senate oversight letter last week. And it's part of what's been driving the funding in the US for childcare for healthcare workers. Currently, we've also realized that risk isn't just about probability, it's about consequences, Jay. But what we know is that who's exposed and what the risks are out there, we can quantify those already before particularly rural communities experience this, using data from the National Health Inventory Survey, the quarterly census of employment and wages. And so we've built yet another dashboard that's up online that looks at the probability by industry of different complications. So this is the kind of stuff that we can do. It's actionable. It's helping decision makers. We've been getting emails from various state governments, local governments about the child care stuff. We've engaged with the largest child care sort of support industry group around this. This is the kind of actionable stuff, and we know where these data are. And I think that's what makes us particularly useful in dealing with those of us who deal with environmental problems, economic problems. We know these data, and they're not the data that would typically float around in sort of epidemiology or public health. And this is what we bring as sort of a comparative advantage. Next slide, please. Next slide, please. Oh, there we go. Here, this one. Can you just click? There we go. I didn't mean to have animation in this slide. Can you click one more time? Thanks. So the other thing that we're really good. Nope, back one. Yep, there we go. The other thing that we're really good at is sort of thinking about where does behavior sit in models. So this is actually work from Mexico City. Actually did shutdowns during the 2009 swine flu epidemic, and Mike Springborn, Matt McLaughlin, and Gerardo Chaval and I looked at those. And we use television viewing data to proxy time at home. Jude Bam and I are now using cell phone tracking data. But what you're seeing here in this figure is those gray bars are when the public shutdowns were in place, and the lines are basically different cuts of TV viewing data. You can see TV viewing dropped off before shutdowns ended. But what we were able to do with those data, I think more importantly, is we were able to work, Gerardo is an epidemiologist, we were able to work together, and we were able to show that you could get more stable estimates of some of the fundamental epidemiological parameters And most importantly, is sort of that panel B in the middle column here. We show that by building behavior into those epidemiological models, we can actually do a better job forecasting the epidemic. And so again, this is a place where I think economists who can think about behavior and know the data sources for that behavior can be really helpful in collaboration with epidemiologists and public health officials. The other part that we've worked on for a while.
Eli, I hate to do this, but we got to move on.
Sure.
One sentence.
One sentence. There are lots of great modeling that can be done, putting together the economics and the epidemiology in the epidemiological models. I won't explain the math. There's citations on the next slide. I'm going to be quiet.
Thank you. Next slide, please. Okay, Cece.
Hi, hello, everyone. Thank you for this opportunity. So basically, I will just briefly introduce three topics, related topics that we are now starting on the social distancing and adaptive behavior in Chinese cities. So here, I think basically I bring in two unique angles. One is this cities. Basically, my field is urban economics and environmental economics. So basically, you know that cities are some places with very dense population and people come here to interact with each other. So these social interactions, they have the benefit of these agglomeration economies and knowledge spillover, innovation, etc. But now in this very special time of the social distancing, this is the opposite force. And I just put this social distancing versus social interaction in the cities context. The other angle is China. So basically, my research basically focused on Chinese cities, and for this one, especially, and because you know that China the first country went through this COVID-19 crisis, and many cities already have gone through the whole curve of this. Now some of them, they are in the recovery period. So then we take advantage of that, and we are doing these three projects. The first one is together with Eli and Jude. So I think the logic is very aligned with the first two speakers to understand the interaction between this top-down centralized decision-making, this social distancing policy, and the bottom-up individual behaviors, and to understand this interaction and the incentives and behaviors and the intended and unintended consequences. So the first one basically is 344 Chinese cities in the big data, and you see this big data details in the three maps. So basically, we have this geo-coded social media data to understand people's sentiment, perception, what they're talking about, whether they are upset, depressed, and also their intention and their attitude towards the social distancing policy, and also the mobility data of the intercity movement and the intracity movement, and also this some like the Dianping.com, that's a Chinese Yelp data to see whether people go to restaurant, and also that POI data. So using those big data, we are going to start this bottom-up and the top-down interaction story. So we will first construct these real-time indicators of those things from the big data and very fine spatial and temporal granularity. And based on this data, we are going to develop such an economic epidemiology model to count for how those individuals behave in response to those social distancing policies. And we highlight this heterogeneity because we have 344 cities. So we can study all the cities are different. And also some like, even within a country, we still have the cultural difference, risk preference, rich people, poor people, etc. And some cities like Wuhan, they have very strict, extreme monitoring, those lockdown, but other cities, they have like a moderate, and also the timing, some cities are really relaxed. So those heterogeneity. And then our goal also, besides a paper, we are going to develop such an online platform to visualize all those things, and to support the public health officials to design some optimal or something like better social distancing policy. And we are thinking, because China is the earliest country, and we hope that our knowledge we found can be transferred to other countries who are entering the very crucial point of this COVID-19 curve. Next slide, please. And so this first one is like big data, 340 cities. And then second one is we go into a specific city. It's a medium-sized city, Zhengzhou City, in the middle of China, and we do a RCT. So we are now in the first week of the RCT. So basically for this one, we focus on leader activities. We have our hypothesis that because this city is already in the recovery period, we observe and also we guess people will first go back to work because they need to earn money, but they still sacrifice their leader activities like going to restaurant and to parks. So we started that, and we designed our app, and we installed the app into 800 people in that city, and we use this app to give them information. So basically we give them information of what other people are doing, whether they plan to go to restaurants and go to open park, and we see how individuals respond based on their perception and our information of the knowledge of their peers, the behavior of their peers. And we do restaurants, it's indoor, it's more people, more risky. Outdoor open park is less risky. So we try to distinguish between two mechanisms. One is social learning, you just follow what other people are doing, and the other is more people is like a proxy of the risk, and you try to avoid that. So that's our RCT.
Yeah, can you one sentence on number 3 and then we'll move on, please?
Sure. So the third project, one sentence, we just expand to this restaurant social distancing in consumer cities into 22 cities all over the world. And then we can start at different countries, different culture, and different phases, how they recover and how that will hurt the city as a consumer cities.
Great, thank you very much. So the next one, please. Thank you.
Hi, my name is Linda Tunstrom, and thank you so much for having me. Thank you, Cathy and Eli and Jay. This is amazing. I'm going to talk about behavioral responses, and yeah, we can move on to the next slide even. Thank you. So we pulled together a team at University of Wyoming to look at, what can we do to be most helpful in responding to or gaining new knowledge when it comes to COVID-19. And we've done a few things. I'm going to talk about the behavioral economic stuff that we're doing, and then Steve later is going to talk about another study that we have, or studies that we have ongoing. But the first one here is the willingness to test for COVID-19. So we know that it's important to conduct widespread testing, and ideally we will do that randomly. Now, of course, since we can't force people to take the tests, there is going to be some self-selection into the testing, and there is a literature on willful ignorance that shows that people may avoid health information. So we wanted to know, should we worry about self-selection into COVID-19 testing, and who is it who would avoid those tests? And what we were primarily worried about was that it would be the potential super spreaders who would avoid testing, because if you test positive, the cost of that might be that you're urged to self-isolate for 14 days. So if your preference is more towards hanging out with other people, or if you have a job that means that you need to meet a lot of people, that cost might be higher for you than it would for other people. So that was our worry, but that's not what we found. So we posted this paper on SSRN yesterday, and we submitted it to a journal today. So it is all written up, and what we find is that the social benefits actually weigh really highly in people's decisions. So in this particular study, we find that it's the extroverts or the potential super spreaders who are the most likely to take the tests, and not the least likely. So, and we also find that people's ability to afford, to sustain either financially or emotionally a 14-day self-isolation, that doesn't seem to matter at all to their decision. Now, of course, the usual stuff pertains in terms of this is a hypothetical study and so on, but hopefully, we're starting gain knowledge anyway on who would want to get engaged in those tests. So that is one study that is done already. Another one, or two other ones that we have ongoing for which we're currently collecting data is compliance with social distancing. So to what extent people comply and how that compliance lasts over time. That also relates to what Siki talked about and her results with, or her studies with Eli. So it seems like there are ongoing efforts there on compliance with social distancing. So in some sense that's good, and it also means perhaps duplications. But willingness to vaccinate against COVID-19 is another study that we have. So it's urgent, of course, to get a vaccine out there or effective treatments, but then the question is, are people going to use those? So we are particularly interested in the anti-vax movement to see how they would respond to the vaccine. We have collected the data for this study to see the compliance rate currently with the vaccine if it was available today. Now, of course, it's not available, so when it's available, people's attitudes might be different, but that's also where our study comes in terms of we can change people's behavior. If we know their attitudes now, then we can work like authorities did with the measles vaccine hesitancy, and when we had the recent measles outbreak to change attitudes of people to comply more with the vaccine. And our goal there is to connect that to an epi model as well, so that we can see what vaccine hesitancy might do to disease spread. All right, so next slide, please. Then there's a bunch of other stuff where behavioral economics can be incredibly helpful. Not just behavioral economics, behavioral sciences in general, psychology, sociology, and so on. And particularly important right now, how do we get people to keep up the social distancing? How do we get them to engage in preventive behavior? Just like hand washing, for instance, that we know can save lives, but how can we encourage that? And there is a new study by Jordan et al. That came out that showed that instead of using nudges that tell people that they should do this for themselves, we should use nudges that tell people that they should do this to reduce disease spread for the sake of others, which is interesting. So that again tells us that, in this current crisis, people might be socially motivated. And, just pretty much like the effort that Cathy and Jay and Eli are putting together now, the research community coming together, and we're doing this, not only the research community, but the community in general, we're putting together to do what we can to prevent this crisis from getting any worse. Negative effects from social distancing. Well, Eli talked some about the unintended effects from social distancing. Those are important to study. What are they? Well, we don't know yet, and maybe some of these answers we won't get until after this is over.
Linda, could one more sentence? Sorry.
Oh, that's fine. And and then information. How do people process information from different sources? That's also super important. Thank you.
Okay, hi, my name is Simon Monge. I'm an economist at the University of Chicago. If you can just hit to the next slide, Mark. Okay, so me and some co-authors, David Berger and Karl Herkenoff, wrote this kind of short paper on trying to think about testing asymptomatic cases. So what kind of got us thinking about this was, it seems like there's no way that you could implement some kind of time-dependent policy to say, okay, we're going to end this at a certain date. What matters is kind of the state variables of the economy, and those state variables are going to be something like, who's quarantined, who's not, how many people are infected, et cetera, which kind of spill out of these epidemiological models. And it seemed to us that, even if you got down to a small amount of people that were infected, you'd still have to impose kind of quite heavy social distancing. And I'll talk about some of the issues that Flavio raised regarding that in the next slide. So it seems like some kind of testing is going to be useful. Sorry, Mark, can you go back to the last slide for now? Okay, so that was this kind of starting point. We probably need some kind of testing. There's lots of evidence that people can be infected but asymptomatic, and we're getting increasingly better evidence about that. So this is kind of an overview of what we do. We kind of think of a world without testing where you can't separate out asymptomatic non-infected individuals from asymptomatic infected individuals. There's a bunch of people that never develop symptoms. There's a bunch of people that are asymptomatic and then become symptomatic in around 6 days on average. Suppose you can separate out the people who have symptoms. And then kind of how would you socially distance these two groups of people? In a world without testing, these are the only two groups of people that you kind of have. You might want to partially quarantine people who are in these unknown cases and fully quarantine people who you recognize as symptomatic. With testing asymptomatic cases, you could separate out and kind of target your quarantine more effectively. You can separate out negative, non-infected asymptomatic people and infected asymptomatic people. Potentially weaken quarantine on asymptomatic people and tighten quarantine on people that you recognize as symptomatic. So what we do in the paper is we take this standard kind of epidemiological model without any bells and whistles. We add this testing and this incomplete information. It's kind of a proof of concept. We basically take the model underneath this first policy without testing, take the model under the policy with testing. We show that you can have the same total mortality over the epidemic under both of these models, except as you ramp up the testing, you can kind of keep the mortality at the same level, except reduce the amount of quarantine. You can kind of increasingly release people, and you can even release people who you don't know anything about without incurring additional deaths. In an economic model, that's going to increase labor supply into the economy and increase output. Okay, so Martin, if you could just go to the next slide. Mark, sorry. Okay, so we put our papers online. There's our codes there. There's a user interface we knocked up so that you can play around with just run it in your browser. It's totally proof of concept. It's something to point to because there, from what we could see, there wasn't epidemiological models with testing. It doesn't consider optimal policy, which is the kind of stuff that Flavio has been working really hard on. There's a paper, recent working paper by Piguem and Shi, and these are all links that kind of solve for optimal testing and quarantine in this model. There's theoretical issues like those that Flavio raised regarding kind of enforceability. So both of these are kind of a social planner choosing these policies. So with complete enforceability and not considering kind of moral hazard issues of people that might want to not test so that they can go about their daily life, and whether we can force people to test and can we force people to quarantine given that they're testing. There's also allocative issues. Currently testing requires a lot of PPE. You got to swab somebody right down the back of the throat. It seems like most of the negative tests, the kind of the false negative rates that are coming out of tests is mostly because you just get bad samples because people are kind of hesitant to put a swab all the way down the back of your throat, back of your nose. So right now it requires people that are trained to do it and requires PPE. Clearly there's allocative issues that PPE should be in hospitals. So we need models that can kind of understand these trade-offs of where to allocate tests. Technology is improving. John Cochran's talked a lot about group testing, and there's technologies that are there for that as well. One thing that's useful from the theory, once you write down the model, is it kind of reveals to you important things and important parameters to measure. So although some people might think we're reinventing the wheel, actually writing down the model and playing with it kind of tells you what's important. One thing you think about is there's false negative rates. These might be overblown if you had better kind of testing procedures. Rates of asymptomatic transmission seem high. These are really important parameters to measure before we can kind of understand the role of testing. And the rate at which individuals fully recover before showing symptoms is also really important as well. Our paper as it stands doesn't have kind of serological testing in it where we test people who are recovered to figure out whether they have antibodies. But these are kind of issues that we need kind of better measurement on. And then, the model tells you what to measure. You can go out and measure it, then we can integrate it back into the model. I don't know how much time I've got. If I've got another minute, we've also got a short paper that's on my website, which isn't related to testing, where we essentially kind of look at the characteristics of individuals that are more likely or less likely to be able to work from home. Kind of find that social distancing disproportionately is going to affect people who are poor, people who are not white, not born in the US, and far less likely to have a college degree. So the economic impacts of social distancing also require kind of careful modeling in terms of the resources available to individuals to get through social distancing. Okay, thanks.
Thanks, Simon. Awesome. Steve.
Is that me? And can I be heard? Okay. So first, again, thank you, Cathy, Mark, Eli, Jay. Thanks for setting this up and inviting us. I'm going to give a quick overview of the work, some other work that a few of us in the Department of Economics at the University of Wyoming have done to compare sort of from a big picture perspective, the benefits and costs of social distancing for this epidemic in the US. So I'll summarize what we've learned so far, and then I'll note some aspects of this problem that we need to learn more about to sort of better refine the preliminary analysis we've done already. Okay, so this is the slide I want now. What we've learned so far, and Simon set this up well in a sense. I appreciate the remark about the usefulness of writing down the model to reveal things we need to know more about. So from my perspective especially, I'm trying to play rapid catch up here, and this is a good way to sort of get our foot in the door. So what we've learned so far is described in a short paper that you can find online at this link. And so here we use a standard SIR model with one extra feature basically to represent the elevated case mortality rate if infections come so fast that the healthcare system will be overwhelmed. And so not everyone can receive the same standard of care they would get in normal times. So in this model, the benefits of flattening the curve come from not only reducing the total number of infected individuals, but also spreading them out over time. So that eliminates or reduces at least the duration of time that the health care system's stressed. And on the cost side, we adopted forecasts from others on the possible impact of the outbreak on GDP over time under scenarios with and without social distancing. And what we find in our benchmark case is that net social benefits are positive, present value on the order of $3+ trillion. And we also conducted a number of sensitivity analyses to basically explore the combinations of model parameters that give positive versus negative net benefits. Next slide, please. So what I have listed here are some of the things we still need to learn to improve this kind of analysis and to improve our ability to make practical policy recommendations. And so when I say we here, I at least mean me. Some of these are addressed to a smaller, large degree by studies that already appear in the literature, as Flavio emphasized at the beginning. So the task for us would be to consolidate and synthesize those findings for our applications. But some of these might call for new research entirely. And some of these might be feasible to learn in the short run to inform our current responses to this epidemic. Others are longer run issues still important for future epidemics. And I'll just highlight a few of these. I won't run through all of these, but first, we'd like to have reliable estimates of the cost and relative effectiveness of different categories of social distancing measures. In our studies, sort of all the social distancing measures that we anticipate are represented in one bundle. So we'd like to break those out. A vaccine is clearly needed, the sooner the better. So we'd like to understand the trade-offs associated with accelerated vaccine testing requirements. There's a set of behavioral economics questions. Linda touched on some of those we're already thinking about beliefs regarding personal risks and social benefits, and other measures, including vaccines, that we'd like to better understand. And skipping to the last one, ultimately, to help manage the economic impacts of responding to epidemics like this, I'd like to learn how to improve the resilience of the economy to intermittent shock. So resilience is a concept that's more familiar to ecologists than economists, but new thinking about resilience, I think, for our economy seems now to be especially in order. And I'm done, so maybe I've saved a few minutes for the next person.
"53 seconds short." Thanks, Jude. Jude,
right.
You're up.
All right. Can you guys hear me?
Yes.
Okay, great. Thank you. I'm Jude Bayham at Colorado State. Next slide. So I overloaded the slide. It's more like a poster, right? So I'm just going to sort of walk through. And fortunately, Eli touched on several of our collaborations. Just want to mention up at the top a bunch of people that are part of this effort. And it really is a team and interdisciplinary effort. So thanks to everybody involved. So Eli mentioned our paper that just came out last Friday in Lancet Public Health, where we're looking at this potential unintended consequence of school closures on healthcare workforce. I also wanted to mention another paper. Well, I think Eli touched on this 2015 paper where we measure voluntary avoidance behavior. So whether people engage in sort of distancing voluntarily or not. And in that effort, we use the American Time Use Survey to construct these probabilistic contact matrices. That's what I'm showing in those bluish kind of figures. On the far left is the weekday household contacts, where you can see in the household, a lot of people of near the same age contact each other. That's the line sort of going down the middle. And then those little sort of blobs on the side are children and parents, right? So that's not shocking, but now we have some sort of empirical backing for these contact matrices. In the public sphere, children contact each other at school and adults in the workplace primarily. When you put those two together, we get this little figure that others have seen these patterns, right? We kind of call it the rocket ship, but it gives you a sense for where populations interact with each other, and you can sort of highlight the school and the workplace and then the home, and you can see how these linkages ultimately matter. So we feed these into the compartmental models that people have mentioned, and I'm actually going to leave that to Alyssa because I think she'll do a better job explaining that. But I think one of the key parameters here is this beta. It gives the rate of disease transmission based on contacts between susceptible and infectious individuals in the population. What we're trying to do is really pull that apart, right? That parameter contains biology and behavior, and we're trying to pull that apart so we can focus on the behavior, understand that, model that process a little bit, and try to get better estimates of how some of these interventions that are ultimately behavioral interventions affect outcomes. And so what we find in this paper with voluntary distancing is that alone during the 2009 swine flu could have accounted for about 13% of cases. So the counterfactual being, if no one engaged in voluntary distancing, the epidemic would have been worse. So a lot of these links and references are similar to what Eli had mentioned. So next slide, please. Okay, so moving forward, the organizers asked us to talk about our current work and where we see the important questions, and this was sort of what I came up with. So distancing is here. How long will people comply? The upper right-hand panel is showing time spent at home based on cell phone data, and we're getting that very regularly from a company called SafeGraph. They're incredibly willing to share data, so if you're interested in this stuff, contact them. What I think is interesting about that graph in the far upper right is that we've seen a lot more time spent at home, as we would expect as these policies are put in place. LA seems to be turning. I don't know if that'll persist or if that trend. If we're coining terms in this, I'm trying to start a term, distancing fatigue, and maybe that's not fair. Eli documented this, as he mentioned, in Mexico City. So we're sort of looking out for that. I'm going to skip to that third one, the unintended consequences. We're also thinking about these other consequences of these distancing measures. So that the time series plot on the left is showing cases or reported domestic violence as a fraction of total crimes reported in Denver. We see a slight uptick. Obviously, we need to do more work on that, but that's something we're pursuing. And then I think, our attention has really focused on, now we're distancing. How do we get back? How do we start relaxing some of these distancing measures? So the plots I have in the middle are actually from this working paper that Eli mentioned, I think, but where we were looking at school closures, and instead of using empirical measures, because we haven't observed these until now, I was using the American Time Use Survey and actually going and modifying people's diaries. Like, you can think of it as like synthetic behavioral modification, then constructing these contact matrices that I showed in the previous slide and simulating these epidemics out. I think one important thing to note here is you can get second waves if these distancing policies are put in place too early. That's largely because you just leave too many susceptible people in the population. Okay, moving over to that panel, that figure kind of to the right, we estimate the policy costs as a fraction of cases averted. So you can think about that as a cost effectiveness measure. I think one of the takeaways of that figure is to show that if you start a policy early, and again, this is school closures, but I think these would hold for other distancing measures as well. If you start it early, they're actually not very cost effective unless you keep them in place for a very long time. And that's
Jude, can you finish up? Wonderful,
sure.
thanks.
Yeah. So I think, moving forward, we are looking to use this framework and integrate it with current cell phone data to try to understand what policies we can repeal quickly. Thanks.
Thank you. Next, I think it's Alyssa. Alyssa.
Hi, is my video on now? Great. Thank you so much for having me. I'm going to be presenting some work on behalf of the COVID-19 Statistics, Policy Modeling, and Epidemiology Collective, which is a multi-institutional, multidisciplinary group of about 40 people that have been working to respond to the COVID-19 epidemic along a few different lines of work. Next slide, please. I want to highlight two parts of our work that I think will be particularly relevant for the audience here. The first is that in the course of sort of emergency policy modeling for a variety of stakeholders, we have stood up and made publicly available two models. These models have both code available and are available to play with in an app form. The first is a classic age-structured SEIR model that you've heard about from other people. This is a model that mechanistically predicts the trajectory of the epidemic with parameters like the length of infection, the contact structure between infected and susceptible people, and the rate of testing among symptomatic and asymptomatic individuals. The second model builds out the sort of infectious component of that into a hospital capacity model where infected individuals move through a hospital system, and we consider the impact of breaking hospital capacity constraints with queues on both the ICU and hospital beds and the resultant mortality impacts. While a lot of our work has been focused on those models, which as I said are publicly available for people to use, I also want to highlight some work that we've been doing on uncertainty analysis and the value of information. So we have a brief research report that we've put together, which has emphasized that a sort of first generation of mathematical models emphasize an imperative to act quickly or face intolerable levels of morbidity and mortality from the disease. But we think that a second generation of models that are looking at policy questions like when we stop social distancing, which will be much more sensitive to the large amount of uncertainty we have in these problems. To that end, we urge people working on these problems to both explicitly consider uncertainty and to assess the impact of gaining new information about different parameters on the decisions that they're seeking to guide. Next slide. I also want to highlight, though I encourage you to look at both of those, the sort of pieces of information that we were asked to weigh in on, and in particular, areas that I think would particularly benefit from an economic mind and economic toolkits. The first point that I want to echo is just Cathy's call to be co-authoring with epidemiologists and public health experts. If you're working with these types of models, I think it's incredibly valuable to have people who have intuition about model behavior and calibration working with you. Personally, I've worked with these types of models across several different disease areas and wouldn't think of doing this kind of work without more experienced eyes on my models for a typical disease, much less one like COVID-19, where we have limited information about the biology of the disease, the impact of our interventions, and limited data available to which to calibrate it. I also want to emphasize the value of collaborations. As someone who operates in daily life like an interdisciplinary scholar, a lot of times different literatures have similar methods with different names, and I think it's really valuable to be able to translate your results to ensure that you can talk to the widest possible group of people. If you're doing research, I encourage you to look at medRxiv, which has a lot of health systems research that might be answering similar questions. Third, I think it's incredibly important to be grounding work in current policy constraints. I know that environmental economists are not unfamiliar with the possibility of operating in suboptimal policy realms. And so with that in mind, I want to highlight three key questions that have come to our attention as things that we think would be really useful to have economic perspectives on. The first is a practical interpretation of how we get from where we are now, which by all accounts will be an incredibly difficult month with incredible scarcity and mortality, to where we would want to be under realistic assumptions about resource constraints on things like testing and public health systems and what investments we realistically need to make. The second thing I want to highlight is that we've heard a lot about the harms of regressive social distancing policies, but we've heard less about combining this kind of analysis with analysis of a growing realization that COVID-19 is also disproportionately affecting vulnerable groups and causing increased mortality among those groups. And I think bringing those two together would be incredibly valuable in analysis. The third thing that I want to highlight is that as we try to balance economic and health trade-offs in future analyses, we're very worried about quality-type analyses being incredibly difficult to do in an ethical way, given that the elderly population is disproportionately affected by COVID-19, and hope people will think through very carefully about measuring those kinds of trade-offs. Thank you so much, and feel free to reach out to me if you are curious or have more questions.
Okay, sorry I didn't manage to get my slides together in time, but I'll just briefly sum up some of the work that we're thinking about. And I think the real value of what you're all doing is directly applying your skills, your expertise, and your data sets to what's going on in the outbreak. So I want to talk about the short-term, medium, and long-term issues around pandemic policies. And right now, I do think you're all on the right track, but already I know from my involvement with the National Academies Standing Committee that the questions that are coming down from the White House about the science behind COVID-19 seem to be geared towards getting back to work. And clearly that's going to be a major next step in the pandemic for the US and fraught with difficulties. How do you scale, how do you sort of stage a back to work policy geographically, looking at the pattern of outbreaks around the country? How do you do that demographically, looking at age classes, looking at the potential for real significant impact on management of factories and management of offices versus the age of the groups that are doing the work and doing the management? How do you stage a back to work policy based on health-related issues, including immunity, which we don't know much about? We know that SARS immunity started to fade off pretty quickly after a couple of years, which is quick for a virus. We don't know how strong immunity is going to be against SARS-2. So these are key issues that the administration right now is looking at, and I think you can, as a collective group, can get to work on, and therefore have even more value from what you're doing. And the medium term, and here we're talking about next year, the year after. There's a lot of talk about seasonality of COVID-19, and I sort of hesitate to say that. If you look at flu, there's clearly a seasonal pattern to flu outbreaks. There's also a seasonal pattern to measles outbreaks prior to vaccination that didn't seem to be driven largely by climate. So there's a lot of confusion between seasonality and climate. School openings and closures were a major driver of measles outbreaks prior to vaccination. So it would be interesting to start to look at that. I don't know how many groups are doing that, but it would be something to look at. Vaccination too, how effective would a vaccine have to be to really to have an impact on future waves of infection? There's also the sort of beginnings right now of the first prevention policies, the first wave of these. And by prevention, I mean preventing the next pandemic. You know, we've shown with our work that pandemics are rising in frequency over time, the origins of pandemics. That's measurable and predictable based on the rise in our sort of ecological footprint. If pandemics are related to things like the wildlife trade, how well would a ban on the wildlife trade work? And of course, there are trade-offs there because people depend on the wildlife trade for nutrition and for economic growth. So is a ban feasible? How effective would a ban have to be? What about just closing wet markets? What about removing species out of markets? What about regulating some breeding of wildlife to supply the demand? I think there's going to be some really interesting work that could be done around that. It's going to have medium-term value. There are already measures in place in China to ban the wildlife trade. How effective they're going to be policed or even going to be at all is a question. Then what I found very interesting is the long-term future of this. For many years, we've been at EcoHealth Alliance have been putting out science and calling for policy change on the underlying drivers of pandemics, and that there are data out there on what drives pandemics. It's very broad scale stuff, but it's basically goes back to complex issues around deforestation, wildlife hunting, livestock production. How can we generate policy ideas? There are already some out there, and what I'll try and do for the next time we meet is bring some of those policy ideas that have been proposed to the table to think about. How can we generate analyses about whether those policy options will be viable? Who's going to pay for increased biosecurity around livestock production? Who's going to pay for a change to the way we build roads into patches of diverse forests with diverse wildlife? And then secondly, the policy options around reducing spread. So the first that I talked about there, reduce spillover. What about reducing spread of pandemics? If pandemics are spread through high-speed rail and road networks, if they're spread then through international travel and trade, how do we try and reduce that? Can we think about quarantine measures? Can we think about more effective policing of travel? And how could that happen? What would the cost of that be, and what would the benefits of those be? And I think there's some really interesting questions to ask. Those things are going to be grappled with, and if we don't do some work on them, they'll be grappled with and decided upon without analysis and without data. So this is where you can have a major impact, I think, on truly the end of the pandemic era if we start to get to that. Thanks very much. Back to the panel.
Thank you, Peter. That was remarkable, a wonderful ending. I'm going to pause for 5 seconds for everyone to give a virtual round of applause or send your strong vibes to this amazing panel of 9 speakers we've just heard. As you can tell, they are literally in the weeds right now, and their time to come and talk to us and share ideas came at a high opportunity cost. So really, really, really appreciate what they've done. We're going to go right next. I'm going to pass it to Jay Shogren, who is going to moderate our panel. With no further ado, I'm going to go to you, Jay.
Thanks, Kathy. I've asked the panelists to respond with 2 things they've heard that are worth repeating and 2 things that they haven't heard that they would like to think about and have other people think about in the future. And I'm going to start with Kevin Berry, please, and I will mute.
Sure. Thanks, Jay. I just want to start by thanking all the panelists for the invitation to come watch these talks and give my 2 cents. It's really inspirational to see how quickly a lot of these teams came together to sort of respond to the pandemic and try and help guide policy. And I think that's probably the first of the 2 things that I've seen is how quickly and responsive the field is to trying to help inform policy with data-driven stuff instead of just op-eds. I liked Eli's line about stop writing op-eds. Everybody's read them now. We can move on to more useful things. And with that, kind of the general theme that stood out to me from a lot of this work is that it's built around social distancing. So when we talk about policy here, a lot of it is focused on social distancing as sort of the solution, which in the short run I think makes sense because that's the policy that we've sort of picked. That's what we're going with. And so it's important to know the trade-offs, the unintended consequences, and the ways to minimize the costs of social distancing. And so it was a theme that I generally picked up on that I think is very useful because it sounds like policymakers right now are very much concerned that they're selling their economies for public health, and they want to know at least what the price is if they're going to do that. And so this production of very useful either tools that are user-friendly or very simple numbers and stuff that people can point to and say this is effective or ineffective, and this is why we should be doing this, I think also helps with public communication too. I liked some of Jude's work and other work that was mentioned about how long people are willing to continue social distancing. And I think having credible numbers that policymakers can point to is incredibly important when they're trying to convince populations to do the right thing or what they're saying is the right thing. In the longer run term, I think Peter brought this up, that there's a need for work that focuses on sort of what the other policies are, how we build resilience to pandemics, how we design other policies taking into account the potential risk from public health, how we incorporate this into things like natural capital pricing to think about the risk of infectious disease outbreaks, from globalization and economic growth and other changes that are showing up. I think one of the things that sort of stood out to me is it seems like we have an awful lot of environmental economists, but of course, and some behavioral economists here as well. But there's other fields, potentially like regional economics, that can look more at how local economies can potentially be long run impacted by these outbreaks, and what we need to do in the long run to make sure that, sorry, I'm trying to put my thoughts together very quickly, that these sort of short run bumps don't become long run sort of death sentences for small communities or rural areas too. So I think there's a lot of interesting work to be done on regional inequality and designing policy to be sort of equitable and to work that way too. And that also works with within socio-demographic groups too. I think there's some interesting work on whether or not, for instance, COVID-19 is racist, or whether or not it and how it's interacting with different groups and different populations in the country. And in the very long run, I think there's a lot of room for work focused on how we build a more resilient economy. So we build one that's resistant to these sort of short-run interruptions, and how we also invest in sort of prevention capital stocks or adaptation capital stocks. And I'm sort of, I guess, promoting my own work here, but I think it's become increasingly apparent that it's useful to have some sort of insurance. We've talked a little bit about the process of how these things work, where we're in the adaptation phase here, but there's also the opportunity to prevent or mitigate them beforehand. And so I think there's some useful work to be done there, thinking about what exactly prevention and what exactly insurance on a national scale looks like. And I think that might be a useful next step for people to think about as we move away from this sort of short-term immediate response to try and support policymakers, to thinking in the long run, how do we deal with a world where pandemics are a risk that may reoccur more frequently? So thank you for the time to share my 2 cents, and I'll return whatever's left to the chair.
Well, Kevin, can you talk for 30 seconds about a pandemic fund, like a sovereign wealth fund, like in Alaska?
Yeah, I've got opinions on sovereign wealth funds. Yeah, so I think definitely there is room for that sort of investment. One of the things I think we've seen with this outbreak that stood out with things like the IMHE model is that the United States does not have surge capacity or enough beds for these outbreaks. So we've been designing these other policies like social distancing to try and keep ourselves under capacity constraints. So there's obviously, I think, a very important question now of how big a sovereign wealth fund or surge capacity should be to reasonably increase our capacity and limit the amount of social distancing or other policies we need to do in the future, while also not potentially overspending. You don't want too big of a savings account in these kind of situations, but you don't want to get stuck with some of these second best policies when we talk about things like increased domestic violence, increased drug and alcohol use, and long-run potential unemployment and other consequences from social distancing.
Thanks, Kevin. Much appreciated.
Yep. Thanks,
next, we'll have Jim Hammett, please.
Okay, great. Thank you all. So I heard an awful lot of good things presented already. I thought what I'd do is sort of offer a little perspective, in that one perspective is to analogize this problem to climate change that many of us in our field have worked on for a very long time. And in the early stages with the pandemic, as with climate change, we have to act before we know very much about how bad it will be. But the time lags in the system are such that if you don't act before you've observed the actual harm, it's just too late to do so. But of course, in the pandemic, things are going much, much faster. It's what takes decades on the climate problem takes days in the COVID problem, perhaps. So, and then the other compounding thing is here we're dealing with exponential growth, which isn't so relevant to climate, I think. The current stage, I think we're in some sort of a medium-term management problem, where what's interesting here is, or I would frame it as a dynamic control problem under uncertainty, where we don't really know what the ongoing rate of infection is. And we also don't know much about how susceptible it is to different policy interventions. A factor that's come up a little bit has to do with the seasonality of the transmission, whether it is seasonal or not, and to what extent, and how that will matter. And then clearly an important thing that some people have talked about, how we're learning about, is how much do certain interventions do to affect the rate of transmission? And then, of course, how costly are those different policies, and can they be combined in ways to have a greater positive effect and reduce the harmful adverse effects? Then I think in thinking about this problem, it's probably important to recognize a high degree of granularity. Like most transmission, as I understand it, occurs within households or within very small groups. Most of us in our daily life don't see very many people. So it's super local possible transmission, but then there's transmission between these local groups, either between households or between countries, as we well know. So it's sort of a lot of separate little clusters that are linked in a sort of haphazard way, although with some regularity. And then there's the question of the longer run that people have talked about a little bit, which is how do we get out of this? What is the sort of stabilizing situation? In the climate world, a lot of integrated assessment models have assumed a backstop technology. And that, in this case, I guess, is the availability of a worldwide vaccine, which will arrive maybe with some probability over time. And then I wanted to mention just a couple other ideas. So a very central element of environmental economics is thinking about different policy instruments, in particular taxes and tradable permits. And this may be a crazy idea, I sort of think it is, but it might be interesting to think about whether those instruments do have any relevance to controlling the pandemic. And if so, what are the merits of different instruments? Another thing that's very important, a couple of the presenters talked about, is testing. And one thing I've learned about is there are much more efficient ways to use a restricted set of tests. Like if the restriction is not the swabs in the individuals, but rather the PCR analysis, you can combine a lot of samples from different people, run it through the PCR once, and when only a small number of people are infected, you'll see that that whole block of people is not infected. And you can do that using the test only once. And there are similarly other ways to things like pool blood before testing for different things. So we could get a lot more efficiency out of constrained test resources. And then final thing I want to mention is, I guess, having to do largely with preferences and risk perception. And obviously a question that's got attention is, are we overreacting to this problem? We have tens of thousands of deaths from seasonal influenza every year. So is this so much worse that we should be shutting down the world for it? Or the other side of that is maybe we should be taking seasonal influenza a lot more seriously than we have been and developing
I'll have to ask
much
you
more to deal with that.
One more sentence, Jim.
Okay. Well, and then comparing how we react to this problem with all the other problems we care about in the world: climate change, pollution, education, poverty, and the like. So I'll stop there. Thanks.
Thanks, Jim. We'll turn it over to David Zilberman.
Great. Okay, this was a fantastic exercise, and I really appreciate the initiative of all the people that really started it. That's what we really need. I learned a lot of things. First, welcome to the discipline of economic epidemiology. I really think that this integration is great. Secondly, obviously we live in the era of data science. We have new sources of data, cell phone, database, and data is important both for immediate use and future research. I think a lot of the stuff will lead to papers in the future. And economics can quantify and learn lessons, but we have limitations. We need to identify questions, we need methods that are fast, not only reliable, and we can sometimes give up perfection for time. If you want to be relevant, we need to operate on 2 dimensions: speed and accuracy, because a lot of time, if you're not in time, you're irrelevant and you're not useful. The other thing is the importance of theory. I really enjoyed to see the simulations. We can have as much estimate as you want, but our relative advantage is to give advice and to use theory to do it. And the key element, the importance of ability to communicate across disciplines. The second thing is the importance of economic concept. Heterogeneity is really important. We really need to identify sources of heterogeneity and how it affects everything. The other is the complementarity of substitution of technology and behavior. What we really see is that a lot of time when technology doesn't work, you need behavior, and a lot of time you need to use behavior to enhance technology. See, this is something that is really, really happening. The third thing is the notion of value of information and asymmetric information. And finally, a related topic with targeting. With good information, you reduce the cost of any problem by targeting and allocating resources where they are needed. Another thing that I learned is the limitation of economics. Economics is part of the picture. We really need to integrate politics. We become almost irrelevant because safety is more important than economic reality, and we really need to understand the linkages. And a related problem is the links within society, the transition from health risk to food risk to employment risk and political risk. We need to understand all this stuff. I think that to some extent, a lot of our policies reduce the health risk, but in some part of the world result in food risk and employment risk. So we need to develop new general equilibrium approach that look at everything. And this is a big challenge that is really important. The third thing is that crisis triggers change. First, I really believe that there is a growing appreciation of science. I think that I hope that climate change research will benefit from it. Secondly, we are moving very fast to a virtual world. The university wouldn't be the same, relationship wouldn't be the same. Then we learn the importance of caution and inventory. You have to be ready. You need to be self-reliant. You have to be resilient. I think you see that government wouldn't allow production moving far away. The other thing is, at the same time, we are part of a global world. We need to worry about other things. We cannot solve the disease in the US and Europe and forget about the developing world. So ideas like pandemic fund and other mechanisms that will help you in a crisis are important. The other thing is, what does it mean for economics? I really think that this is really a leadership effort. We need to have quick response. We need to have multiple outlets. We need to have blogs and podcasts as well as journals. Maybe association will develop journals that within 3 weeks have papers and you have quick refereeing rather than wait six months to have an authoritative paper when no one cares about the topic. And the other thing, where are we going from here? I'm really optimistic. I believe that the damages will be below expectation. Someone will say, oh, we cried wolf. No, without crying wolf, without doing what we are doing, we will have a crisis. We save the world in the same way that the response in Ebola saved the world. There will be a second wave, maybe, but we'll be better prepared. Now the challenge is, are we open school? Do we come back? Do we open school? How do we remanage the economy? I actually worry now that all these new funds, without growing economic activity, may lead to inflation and stagnation. So to some extent, I think that this was an incredible period that is changing the world, changing our discipline, taught us a lot. And if we are smart, we can really come out of it quite stronger. So I'm really optimistic. And I really believe that all the effort that we take actually weren't that bad. Sometimes were fun and will make us actually better off than other ones.
Thank you, David. Cathy, back to you.
I was blabbing away and I didn't have my thing back on. Thank you very much. Very interesting panel, 3 really useful sets of insights from a variety of views. So I'm gonna do a couple minutes of wrap up and then I'm gonna hand it off to Eli for the final word. First of all, I'm just incredibly pleased that this was so rich and so much information here. Remind everybody that this will be placed on video, that it's been taped. It will be available for anyone. You can get it live on Facebook. Go back to the original link site and you'll be able to find information about where it's posted. We will be discussing after this possible next steps, how to move forward, how to be constructive here. Again, ultimately the goal is to information share, keep things moving quickly, and not duplicate efforts when possible. So 2 points. Several people have talked about the need for rapid communication, including David just mentioned it. So I'm going to read through a couple of some resources that I know are available. Some of you may have heard, but there is a new journal that is called COVID Economics. Christian Gallier, I think Jim Hammett may have been involved with this. I'm not quite sure who all is involved, but this is an online journal. It is going to be refereed, 48-hour response time. So you submit, you can referees within 48 hours to get your stuff looked at and get it out there. Journals like the American Journal of Ag Econ are already planning special issues, but those are more intermediate run. Those are not immediate sorts of stuff. Many of the general science public health journals, I couldn't even begin to list them all, but Science, Nature, PNAS, Lancet we heard about, many of them are developing very quick, rapid turnaround for topics specific to COVID. So those are places to look. In thinking about, if you're doing some work and you want to get it out there, I urge you to think about not only where it can go in a referee location, if that's important, but definitely as well, where can you get the information that's most needed now? Again, state and local authorities are making decisions. They're going to have to decide very soon when to reopen schools, how to reopen schools, how and not only when, but how to do it. Can you stage things through the time of day to minimize contact? All the kinds of economic trade-offs and the micro behavioral responses that we study in our community can be brought to bear. The behavioral work that Linda talked about, nudges and a variety of other things can be incredibly valuable to think about how safely, not only when, to do all of these efforts. Finally, I'm going to just note, if you're out there and you're listening and you want to do something, what can you do? You can talk, you can communicate, share what you know. You can bring data that you have in your computer to bear. You may not have thought about using your time of use survey data that's been sitting on your laptop. You may not think about how to use census data. Many environmental and natural resource problems. I'm very interested as an environmental economist thinking about all the now current use of local rivers and streams and water quality. What does this mean about understanding the value of our ecosystem services? The option value of having had clean rivers and streams nearby for people to engage in is coming to fruition. How can we learn from that for future and use that in our planning? Many things that you have as economists, data, tools that you're already thinking about. And don't minimize econometrics and statistical inference when you have rotten data. For better or worse, economists have worked with a lot of rotten data and had to think about how to make decent inference with really incomplete data sets with bias and so on. Think about how those methods can be used. How to minimize things on sensitive populations. Key thing is get it out where it can most be used. With that, I'm going to thank everybody one more time and then hand this to Eli for final words in the webinar. Thank you all.
So I just want to thank everyone for signing on today and listening to us for an hour and a half. An hour and a half has become what feels like a year, I think, to many of us. There's a lot we can do. And it's not all, there's the stuff that's about the testing, and there's a lot that I think economists could bring to sort of correcting rubbish testing estimates, right? We do this all, we struggle with this all the time with our data. But there's a lot of other things around the margins that we can be doing that can really make life better for people right now. And I think that's important. And I think that if we can do that with data and bring data to bear on this, which is what we do, that's our greatest strength right now. That's what, at least those of us in the US, I think that's like the number one thing we've got going for us right now, is that we can be problem solvers. So I encourage everyone else to get out and roll up your sleeves and try and do it, or help cover for those of us who are, because we all need that support. Like, I want to just end by thanking Cathy, who's really exemplified this, reaching out and putting this together. You know, she's done all the heavy lifting for this thing today. So thanks, Cathy.
Thank you, Eli. And I realized there was one final thing I want to say. If we can flip to the next slide. Those of you who have been listening, we said it at the beginning of the webinar, and so this gives me a chance to repeat it at the end. We are collecting information from folks. If you want to click on our, get into the Google Doc form, Mark, thank you. He just put it in the chat window so you can click directly. Name, where you are, and if you'd like to have your name involved in any potential follow-up. We're very much not, we don't know what we're doing next, but we're going to think about what's the best way to move forward. If you're interested in those activities, throw your name on that list, share it with others, and we'll be back in touch. So thank you all, and signing off. So bye.